The first question I want to bat around with you is, let's do this on a scale of 1 to 10. One being the patient has choice. Actually, one being the patient has no choice, they're locked in, and 10 being the patient is a full-blown consumer of healthcare with choice. Where do you think we're at on that continuum today?
I think we're probably close to 3 or 4, but I think the attitudes are changing a lot, and we see it everywhere. And I think healthcare just takes a little longer to catch up, right? But I think what's happening in other spaces is going to begin to have a profound impact on the attitudes people have at healthcare. I mean, clearly, the high deductible was a shock to the system for a lot of people. Is it related to cost? Like, wow, I'm paying a lot out of my pocket, so I'm going to make some different choices about this now. But I think other things. I mean, here's something that's completely unrelated but related, Bill. Take the gig economy, right? Uber and Airbnb and other things. People are thinking differently about things they never would before, right? That you'd have some stranger drive you around, or you'd stay in some stranger's house. That wasn't something we really considered 20 years ago, or even 10 years ago.
Right.
That's changing, and you're even beginning to see some interesting, innovative companies like Nomad and Hire, who are bringing some of the gig economy to healthcare, particularly around a $15 billion a year market for locum, temporary physicians or practitioners. So I think the age of having a single dimensional channel to healthcare are going to change. I think you've got the other factors of all these baby boomers who have grown up around technology. They've been pretty avid adopters of technology. Will look at this and say, paying my bills should be easier, it should be more straightforward. Getting care when I want it, where I want it, at the edge, should be easier. And I think they'll move towards organizations and provider systems that are progressive in that matter.